In this video, a nurse will understand the various aspects of the bandaging technique, steps of procedure, article required, aftercare, and most importantly, what to do when things go wrong. In other words, the common clinical errors. It is a strip of material which is used to immobilize and support the injured part of the body. Bandaging is a process in order to protect or cover the wound. So next we are going to discuss about the purposes of the bandaging. There are various purposes of bandaging such as to protect the wound from contamination, to apply the pressure, to protect the wound from the hemorrhage and to protect the wound from the infection. So next we are going to discuss about the various types of bandaging. The types of bandaging are as follows, that is circular bandage, spiral, reverse spiral, spica, figure of 8, jaw, Kaplan, abdominal binder. Circular bandage. Circular bandage is widely used in a specific body parts, for example, arm, legs, chest, and it is a starting of a bandaging technique. So next, we are going to discuss about the demonstration of the circular bandage. Introduce yourself to patient.
Good morning, sir. This is Shilpa, your assigned staff from 8 a.m. to 2 p.m. Sir, may I know your name?
Karthik.
Check doctor's order sheet. Explain the procedure to patient.
Okay, Mr. Karthik, as per your doctor's order, I have to apply a bandage to you.
Arrange articles, equipments required, a tray containing loose gloves, appropriate bandages, scissor, adhesive tape, dressing material like gauze, kidney tray. Perform hand rub. Wear loose gloves. Select the bandage of proper size and material. Put the patient in a comfortable position and provide privacy if required. Support the injured area while bandaging. Face the patient while applying the bandage except when applying onto the head. Always apply bandage from inner to outer and far to near end. Apply the layer of bandages over the top of each other. With the roll on the inner aspect, unroll the bandage either towards you or laterally, holding the loose and until it is secured by the first circle of the bandage. Encircle the body part a few times or as needed, each turn directly covering the previous turn. Secure the end of the bandage with tape, metal clip or a safety pin over an uninjured area. Aftercare. Discard the waste according to biomedical waste management policy. Perform hand hygiene. and document the procedure in nurse's notes. Key points to remember. Always check for the correct size and type of bandaging according to the location of wound. Bandaging should not be too tight so it can interfere with the blood circulation.